Welcome to the Soul Pit Media Health and Business Report, hosted by Craig Dawson, Vice President, Soul Pit Media.
Hello and welcome to the Soul Pit Media Health and Business Report. Today we have Dr. Amit Tevar, Surgical Director, UPMC Kidney and Pancreas Transplantation Program, and Clay Moorefield, a living kidney donor. Welcome to the Soul Pit Media Health and Business Report to the both of you.
Thank you for having us.
Dr. Tevar, when I first started doing my research for this show, I actually knew very little about the Living Donor Program. Could you educate our listeners about the program?
So my name is Amit Tevar. I'm one of the transplant surgeons here at UPMC. We have actually, I think, is the best way to receive a transplant through our Living Donor Program. So what that simply means is that when someone has kidney failure of any sort, and they go on to get worsening kidney failure, and they get to the point where they go on dialysis, there's two options from there. One is to just stay on dialysis indefinitely. And for most folks, that's not a reasonable option. You know, it limits what you can do. The survival is very minimal on dialysis, and people generally don't do well. And plus, you have to go to a dialysis unit, sit there for 6 to 7 hours, 3 times a week. You can't work, you can't hang out with your family, you can't do the things that, we enjoy doing as Americans. On the flip side, the other option is to undergo transplantation. And what that means is you go to a center like UPMC, we evaluate you for transplantation, and if you are suitable and you're deemed appropriate and you have the kind of wherewithal to undergo transplant and also the health to withstand the surgery, then we offer you and list you for transplantation. From there's two options. Number one, you can wait for a brain dead or deceased donor. And what that means is someone who has been in an unfortunate accident, a motor vehicle accident, had a stroke, and has passed away. And those people that consent, once they finally pass away, we procure those organs, we take them out, we put them on ice, and we offer them to people that are on our transplant list. Unfortunately, there are so many people that are listed for for transplantation that process can take anywhere from 5 to 6 years before you get your first transplant. And just to give you an idea, imagine you're a healthy 66-year-old on dialysis. You're going to be 72 when you get your first offer, which means you're probably not going to be in the best of health. You're going to be depreciating on dialysis, and for most people, it's kind of a life sentence where they are not going to have a good outcome. Now, the other side is what we call living donation. So, what you get on the transplant list, if you had a potential donor, which means someone who's a friend or from a church or from, in some cases, someone you meet at the gym, you can actually offer to donate one of your 2 kidneys to that person, and we laparoscopically remove that kidney and transplant them right away. And that allows you to come off of dialysis. Those transplants work better, longer, and faster. And just to give you an idea of the time frame, if you came today, early June, to see me about being on the list and I have a potential live donor, I would have you done before 4th of July, which means instead of waiting 5 or 6 years, you could undergo transplantation within a very, very short period of time. Success rate is great. Our track record with the living donation part is impeccable, and I think we have one of our superstars of living donation here today, Clay, who's an absolute delight and can actually tell us more what the actual experiences of being a living donor.
Now, Doctor, I also learned that doing my research for this show that only about 26% of minorities that need transplants actually receive them.
Mm-hmm. That's correct.
What can we do to help increase those numbers?
Sir, you're doing it right now. So, I think one of the things that as a trans community we have a lot of work to do on is we've failed to universally educate everyone about the benefits of living donation. There are groups and minorities that actually don't get as much information. And I think that's the one thing that we really need to focus on and really need to do is tell people, hey, these services are available. It's safe. Many people that are African-American donors donate, and they do well. They saved a loved one, and that loved one does well too. But again, like with most things, this is about information, educating everyone about this, and also saying, hey, listen, we're available. I'm a transplant surgeon, but I'm happy to talk to anyone about the process, what it means, the short-term risks, the long-term risks, and obviously the benefits. So I think that's the key thing that we need to do. And, here at UPMC, we're going to make a concerted effort to actually help spend some time and resources educating especially high-risk populations like the African-American community that have a lot of end-stage renal disease about the options and facilitate living donation.
Now, Clay, you were actually a participant in the Living Donor Program. Can you talk a little bit about your experience?
Yes, this is Clay Moorefield, and I am a living donor. Honestly, for me, the experience was amazing. And a lot of people might hear me say that word and might think I'm crazy. Like, well, how could it be amazing when you went through pain and you gave up a part of yourself? Because at the end of the day, for me, helping save my best friend's life, I never looked at it like that. Dr. Tevar and his family members kind of reminded me constantly about what was actually happening. But the experience was great, because for one, the team, Dr. Tevar and his team, the information they provided me with, the whole process from giving the blood work all the way up until the kidney was actually removed. It was seamless. It was great. The information they gave me was true. And I'm saying that because I have a couple sisters that are registered nurses and nurse practitioners. I would talk to them. One of my sisters was actually going to donate a kidney. So when I would talk to them, I would talk to her, and everything lined up. Everything they told me was the exact same thing she told me. When it comes to somebody giving you the correct information, your trust level raises for them. And then from that point forward, everything else was just really seamless. When we were coming to the hospital and they were welcoming us to go into the surgery, they made it really comforting for his family. I was okay. I was relaxed. His family was really uptight. And they even tried to talk me out of it all the way up until the surgery was about to happen. But yeah, the process was really smooth. The information was amazing and very accurate. And I did a lot of research on myself because I wanted to know what were going to be my risk later on in life. And everything they told me was absolutely true. So my trust level for them is very high, and it continues to raise because they continue to push forward and continue to try to raise the awareness of minorities to try to be participants in the living donation program.
Now, Clay, I was just curious, how do you develop a friendship with someone that is strong enough that you would actually consider being a living donor for them?
Friendship's an understatement. It's only a friendship because he's not my mother's son. But the love that we have for each other is the same that I have for my siblings, my blood siblings. And we haven't been friends like my whole life. We've been friends for 13 years. So it's not like a brand new friendship. So we have developed a really close friendship. But he's been one of my biggest supporters since I've met him up until today. All my ventures, and I'm a numerous business owner, all my ventures that I'm engaged in, he's always been supportive and an advocate for me. And just his kids call me uncle, my kids call him uncle. So it's not just really a friendship. It just started as us interacting at a religious service, and the relationship just grew from that point forward. So we start going to dinners and stuff. So we start working out together until we start having our family started interacting with each other, and it just continued to grow from that point forward. So when it was actually time to donate the kidney, it was almost, I would have just said yes, period, without the research. But I don't do nothing haphazardly. So I just had to research and make sure. I'm a father of three now, two at that time. I had to make sure that I was going to be okay to still be a good father to my children and still be an active person in the community and stuff like that. So I had to actually do the research because, just the love would have just had me do it just because this is my great friend / brother. But like, I also didn't want to do nothing recklessly. So I just researched. And once I found out that I basically had to do the same thing that I was doing up to that point, it was a no-brainer after that. I prayed on it and then we just moved forward. And there were some of his family members who wanted to actually donate, but I haven't drunk liquor or anything. I never smoked cigarettes in my life. I haven't drunk liquor or anything since 2009. And I was explaining to him, like, some of the people that wanted to be donors were active, not like alcoholics, but they were liquor consumers. So I told him that I didn't trust nobody but myself to actually be a donor for him.
That is truly commendable, man. And I definitely want to commend you on that. Doctor, I had a question for you too. What type of screening does a potential donor have to go through to be a candidate to participate in the Living Donor Program?
So first of all, I think Clay's a remarkable man who's amazingly humble. So I'm going to sing your praises here, Clay. I've really not met anyone as dedicated, brave, and altruistic as Clay. And there was really never a moment in the process. In fact, the only thing Clay would get irritated with me when was moving faster. I've never seen that kind of commitment, and it's really remarkable, and we like to see that. And I will tell you, much like Clay mentioned, it's the love that matters the most. In fact, a lot of our donors are not family members. They're not your husband, wife. They're not the brothers, sisters. We see them from church groups, car groups, people from work. And every now and then we'll have actually people that just randomly was on Facebook, and I saw someone who needed a transplant, and I offered. So it's amazing, and I can tell you the longer I do this, I still am taken aback by the genuine bravery and honesty and just altruism of your fellow man. It's very, very impressive. As far as the screening goes, so I will tell you, this is the one thing that I hope we can actually convince everyone. Man, I am protective of our donors. And it's not one of those things where you come in and the kidney comes out and you hope for the best. We have a rigorous screen. And so this is what I tell, because every parent, every brother and sister, no one wants their loved one to have problems later on down the road. And we don't either. So we do a very detailed screen. That screening process is done on the phone, and we're looking for things like obesity, early high blood pressure, early diabetes, things that would predict that you'll probably do okay with the surgery, but you're not going to do well down the road. And I can tell you we're very black and white about it. If you have hypertension and you're under the age of 50, you can't be a donor. I won't even let you go to the process. And so I always tell the parents that if your kids wants to donate, that's great. We will screen them only if they pass all of our hoops, all of our screens. Only if they're a perfect candidate to be a donor will I let them move forward. It's not really up to them. It's not one of those things where I'm going to come and say, hey, look, you're at high risk. What do you want to do? Either you're a perfect donor or you're not a donor. And I can tell you, we tell a lot of people no as well. But I do sleep well at night.
We'll be right back with the Soul Pit Media Health and Business Report.
The Port Authority of Allegheny County is hiring. If you're looking for a long-term career, competitive wages, great benefits, and desire an opportunity where very few days are the same, check out the opportunities at portauthority.org. We are driven to improve transit in the region. That's portauthority.org.
We do all we can to ensure our kids are happy, healthy, safe, and strong. Having high-quality, low-cost health insurance helps make that possible. With CHIP, your child can have medical, dental, eye care, and more for free or low cost. Whether you're self-employed, unemployed, or your employee benefits are just too expensive, CHIP is there for you to help your child be strong. CHIP Strong. Apply or renew today at 800-986-KIDS or go to chipcoverspakids.com.
Paid for with Pennsylvania taxpayer dollars.
Looking for a cost-effective way to help increase your company's bottom line? Look no further than Soul Pit Media. With our award-winning print, internet, podcast, and Soul Pit television options, we can help your business get to that next level. For more information, contact Craig Dawson at 412-407-7685. That's 412-407-7685. And let Soul Pit Media take you to that next level.
I have a different outlook on life because it could have been all taken away from me.
Jordan didn't choose to have cancer.
I just thought I had a common cold. I was diagnosed with Hodgkin's lymphoma. UPMC took excellent care of me and got me to where I am today. I'm here, 3 years in remission.
UPMC's Cancer Center is the region's largest, with expertise in more than 30 disciplines.
I didn't choose to have cancer, but I did choose UPMC.
The future of transit is now, and we are working to improve your ride. Look for bus tracking technologies and other innovations to keep you better informed. Getting around town has never been so easy. portauthority.org.
We're back with the Soul Pit Media Health and Business Report. That is good to know. The more information that's out there, the better off everyone involved will be. Clay, I had a question for you. Did you talk to your family about you being a living donor before you actually did it?
I talked to them. I have a very big immediate family. I have 11 brothers and sisters, so it's 12 of us. Yeah, I talked to all of them about it. I consulted with my sisters who were the professionals. Like I stated before, they were nurses. So I kind of talked to them really in depth and detail. But then I had to definitely tell the rest of my family, I had to talk to my children about it. And what was so funny is my brother, one of my older brothers' name is Corey. When I explained it to him, he said, I would have gave him one of mine. So this kind of show you who my friend Omar is with my family. So it just really was like, it was warm, it was welcomed, and it was embraced. And I was encouraged by my family to actually move forward. And honestly, they kind of like looked at me different after that. You know, we always had a really, really close relationship, but when you're willing to give something of yourself to actually help someone out, it raised a different level of respect in the way that they looked at me as a man and as a person and as a genuine friend. So it was just like, it was really welcomed and it was embraced and I was supported. You know, they came past the hospital and seeing both of us. We were very in close proximities at the hospital. They came to see him. They came to my room. So it was like a whole bunch of people going back and forth between rooms because we had such a strong support system.
You know, when I did the research for today's show, I really came away with the utmost respect for you, Clay. That's something that, you know, people just don't do now, you know, and that's why this show is so important, because we need to be more of a giving society than a taking society. And I really have the utmost respect for you, man. I just wanted you to know that.
I appreciate it. Along with just doing the donation, I'm very big on talking and my experience with individuals that are minorities to kind of try to get them to actually do it and let them see and hear a true testimony and actually see me 3 years later and him 3 years later. He's in the best shape he's been in who knows how long. I'm in amazing shape still. Like nothing, it really has actually changed. And honestly, I take such more good care of myself. I kind of feel better. Like I kind of cut back the day I own my own business. So I can kind of take days off when I choose, but I kind of set my business up to where I'm not working as much as I was before. So I feel a lot more refreshed and my body just feels really great. So I just try to share that experience with minorities to try to get them to understand that they can, you know, because the 26% of us receiving it, that's very low. And it's probably lower than that for those who actually donate. I'm not sure of the statistics on that, but for those that's given, it's probably lower than that. And the doctor can correct me if I'm wrong, but we need to step up a little bit, I think, and to try to help each other out a little more.
That is the reason why this show is so important today. Doctor, I wanted to ask you, what type of recovery time would a living donor be looking at once the surgery has taken place and everything, you know, goes well with the surgery?
We won't use Superman Clay as our example, but on average. So it's a laparoscopic procedure. So you literally, after we get you asleep, you get one incision about the width of my thumb, one the tip of my pinky, and then one that's about 10 centimeters or a little bit less than an iPhone size, and that's where we take the kidney out from. The procedure itself lasts 2 hours. There's 30 minutes to get you to sleep, 30 minutes to wake you back up, and then afterwards you're on the regular floor for about a day and a half. Once you get home, and you will walk home, you are feeling pretty good. You might be a little bit sore, a little bit sleepy, might have some occasional nausea. The things that we recommend people do is afterwards, no heavy lifting. And it was tough for Clay because he lifts a lot of heavy stuff. No heavy lifting for a period of 6 weeks. After that, you can do everything you were doing before, and that's no limitation. So our professional athletes like Clay, you know, I've had tennis players and basketball players and bodybuilders. After 6 weeks, they go back to full activity. That means running, walking, jumping, doing whatever you were doing before. As far as limitations long-term afterwards, don't believe the internet. You have no dietary restrictions. You can do everything that you were doing before. If you know, caffeine, occasional alcohol, eating carbs, they're not things that you shouldn't do after you donate a kidney. So you have basically the diet that you were on before. The one thing that we do recommend people avoid is ibuprofen afterwards. But everything else you can absolutely move forward with. So the recovery is pretty good. I always tell everyone, usually I get a Christmas card the first year, and then everyone forgets about me, which is good. That means they got back to a regular life, and it was, you know, something that they did to save someone else's life, and they've moved on from it. And that's what we want to see.
Now, doctor, I must confess to you that I was one of those people who did not know that the recovery time is not that extensive. And if more people just knew that.
And listen, you're not alone, and there's nothing to be sorry about on this, because I think that's a lot of folks. I can tell you, not only is the African American community on par with the rest of the country, a lot of folks don't understand what happens with this. I can tell you, even among physicians, once you get them outside of transplantation, some of them might not know what the recovery period is, and that's kind of our job, and that's something that I need to focus on more, is make sure the word gets out to say, hey, look, here we got Clay, who not only saved his friend's life, but got back to his gym in a short period of time and is now doing well, running businesses, you know, just growing. and feeling good. And that's what we want to let people know. And also the fact that it's a very tough screening process. We don't take, we take these personally. We make sure it's safe for everyone. We spend a lot of time. So even after the evaluation is done, we have a once-a-week meeting called the selection conference. There we put up the patient. We go through every line of their chart. And this is everyone that works here at UPMC in the kidney panc side. So every nephrologist, every surgeon, every social worker, behavioral, it's about 45 people. And if that committee decides that, yes, it's going to be safe, short-term and long-term for this patient, then and only then do we proceed. So it's a very rigid system. It's got a lot of checks and balances. And as Clay said, it's pretty slick and it's pretty fast. But we want to make sure it's safe long-term for all the patients. And again, don't be sorry. The education is actually on us. We have a lot of room to do more education to let people know that, you got superstars like Clay that donated, did great, and their experience can be very similar.
Now, Doctor, that leads me into my next question. How can we as a community encourage others to take part in the Living Donor Program?
So, and I can tell you, I'm not the guy. I can tell you what people like to hear. They like to hear Clay. Clay is a absolute kind of a figure that everyone needs to look at and say, look, if this is someone who can do this for his friend, and like you said, he did it not because of obligation, not because of a need. He did it for just pure love of his buddy. And if he did it and had this experience, their experience will be the same. And I will tell you, word will spread fast. And, here at UPMC, we're very committed to actually spreading the word, going out and doing talks. And, one of the things that we spend a lot of time on is encouraging people to ask questions. And there is no point in the process. And I tell people this the first day I meet them, and Clay heard me say these same lines again. Any point in time, if you decide, what, I don't want to do, you don't owe anyone anything. I'll make it stop. I'm not going to ask why. I don't even care why. I'll make it stop. But everyone has the right to come in and ask questions. We have people that come in sometimes and sit with me for a while in clinic just to discuss the options. And come get some information. We're going to be coming out to the communities to actually give more information. And we want there to be just a good exchange of questions and information so people know what the processes are and what the opportunities are.
Now, Doctor, especially going through the pandemic, it became quite apparent that there needed to be more of a focus on educating our community to the options that are available. And I have to commend UPMC for being there on the front lines, not only with your program, but with several other programs. And the common denominator that I'm finding in a lot of cases is just lack of information. What I want to ask you is, how can our listeners get more information on the Living Donor Program?
So, and again, you're spot on with this. I think that lack of information leads to more misconceptions. And, even just for example, if people are looking for a potential live donor, they always try to match blood types and have to be a sibling. You don't have to be related. You don't have to be the same blood type. We can put an exchange together. Let us worry about all the details. We do have a lot of information on our website. It's at upmc.com under the transplant section. And also, if anyone wants to call, we can always call the offices, and we'll post those numbers for you as well. But you can always call the office, and we'd be happy to talk to you anytime. And you can actually talk to one of our transplant coordinators to get all that information that anyone.
Now, Doctor, I have to say this both to you and to Clay. Very interesting program. I even learned a lot today. And what I want to do is at this time, we got to have you guys back on again in the near future, because this is a problem that's not going to go away unless we educate our community and let them know that this is a problem that can be addressed. And it's not a problem that, you're going to be incapacitated for a year. You won't be able to live your life after you've made a living donor donation to another person and possibly save their life. So I just want to thank the both of you for being on the show today. And I look forward to having you back at some point.
Hey, listen, anytime you need, we're always here. Be happy to.
Yeah. I really appreciate it. It was a pleasure. And anytime. Can I say one thing before we close out?
Sure.
Yeah, just for, our community, we have to understand the numbers. And when we're looking at 26% of minorities that actually receive one, we got to take heed to that. And then we got to understand and seek out the information We got to seek out the information because we are in an information age where things are at the touch of our fingers. And we can't hide from things that we may not be very interested in until someone that's very close to us is affected by it. That's usually a lot of times where people that only look at a situation when it hits home and not look at a situation and think that could be me or my family. And I just feel that we should seek information out before it's actually too late. And then I think some of the transitioning will be a whole lot easier for us because we would be educated beforehand and not having to do something kind of sporadically to try to save somebody. So I just would hope that we search out the information and receive the information when it's being presented and not let it go on one ear and out the other, because you can save somebody's life. And it's actually a great feeling to actually, know that.
Clay, I had a conversation with someone about a week ago, and that conversation was based on the fact that a lot of times in our community, we look up to the wrong heroes. All heroes are not athletes or entertainers. We have people like you in our community that are definitely heroes in my mind. And I just want to thank you for giving the gift of life to another person. And I want to say, Doctor, great job in getting out there and caring about our community. And we look forward to working with UPMC to help educate our listeners and viewers about the Living Donor Program. And thank you both so much for your time. We'll be right back with the Soul Pit Media Health and Business Report.
The Port Authority of Allegheny County is hiring. If you're looking for a long-term career, competitive wages, great benefits, and desire an opportunity where very few days are the same, check out the opportunities at portauthority.org. We are driven to improve transit in the region. That's portauthority.org.
We do all we can to ensure our kids are happy, healthy, safe, and strong. Having high-quality, low-cost health insurance helps make that possible. With CHIP, your child can have medical, dental, eye care, and more for free or low cost. Whether you're self-employed, unemployed, or your employee benefits are just too expensive, CHIP is there for you to help your child be strong. CHIP Strong. Apply or renew today at 800-986-KIDS or go to chipcoverspakids.com.
Paid for with Pennsylvania taxpayer dollars.
Looking for a cost-effective way to help increase your company's bottom line? Look no further than Soul Pit Media. With our award-winning print, internet, podcast, and Soul Pit television options, we can help your business get to that next level. For more information, contact Craig Dawson at 412-407-7685. That's 412-407-7685. And let Soul Pit Media take you to that next level.
I have a different outlook on life because it could have been all taken away from me.
Jordan didn't choose to have cancer.
I just thought I had a common cold. I was diagnosed with Hodgkin's lymphoma. UPMC took excellent care of me and got me to where I am today. I'm here, 3 years in remission.
UPMC's Cancer Center is the region's largest, with expertise in more than 30 disciplines.
I didn't choose to have cancer, but I did choose UPMC.
The future of transit is now, and we are working to improve your ride. Look for bus tracking technologies and other innovations to keep you better informed. Getting around town has never been so easy. portauthority.org.
We're back with the Soul Pit Media Health and Business Report.
Hi, this is Debbie Norrell, and welcome to the Soul Pit Media Health and Business Report Community Calendar. Learning is fun, and Gwen's Girls will conduct a free virtual summer camp for girls and boys, grades K through 12. Gwen's Girls Academic Success Institute has created opportunities for summer learning and sets the stage for innovation, creativity, and leadership. Their programs ensure that youth don't fall victim to the summer slide, which is steeper than ever before due to the COVID-19 pandemic. For more information, please visit their website, gwensgirls.org/events. Pittsburgh will celebrate Juneteenth and Black Music Month from June 18th through the 27th of 2021. Featuring the WPA Juneteenth Freedom Days, Pittsburgh Black Music Festival, Juneteenth Jubilee Parade, and Youth Fest. Join Pittsburgh and Allegheny County on June 18th through the 20th for Juneteenth Freedom Days at Point State Park. This event is a celebration of all cities and boroughs in Allegheny County, featuring Black music genre and youth programs. African American culture education, food trucks, speakers, and a variety of music showcases. The 5th annual Juneteenth Grand Jubilee Parade will be held on June 26. The parade will go through downtown Pittsburgh from 10 a.m. until 1 p.m. This year's celebration will also include a Black Music Festival from June 24th through the 27th, including jazz, gospel, R&B, and soul artists at Point State Park. YWCA Greater Pittsburgh is excited to announce the 2021 Equity Awards, which seek to honor women, especially women of color who advocate for and advance the mission of eliminating racism and empowering women. The categories include the Heroine Award, the Ally Award, the Bridge Builder Award, Creativity and Innovation Award, and the Emerging Leader Award. To learn more and make a nomination, visit ywcapgh.org/2021 Equity Awards. Please note the deadline for nominations is July 28th, 2021. Thank you for listening to the Soul Pit Media Health and Business Report, brought to you by Port Authority Employment. Looking for a great job with benefits? Check out their website, portauthority.org, and click on Careers. Thank you for tuning in to the Soul Pit Media Health and Business Report, hosted by Craig Dawson, Vice President, Soul Pit Media. Thank you, Pittsburgh, for your continued support.